The information shared on this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. The views and opinions expressed by guests or hosts are their own and do not necessarily reflect the official policy or position of any affiliated organizations. Reliance on any information provided by this podcast is solely at your own risk. Welcome to the Healthy Image Podcast. Today's episode is a really special one. We're sitting down with a mammographer and sonographer who began her career in 1982 and has spent over 4 decades caring for patients through one of the most important and sometimes anxiety-filled health screenings a woman can have. She's seen mammography evolve from early film imaging to today's advanced 3D technology, but what's never changed is her dedication to patient comfort, education, and compassionate care. She's been a value member of Huntington-Hill Breast and Imaging Center since May 2016, where she continues to make a meaningful difference in patients' experiences. In this conversation, we'll talk about how mammography has changed over the years, what patients can expect during their visit today, and what makes Huntington-Hill Breast and Imaging Centers a place where patients are truly cared for, not just scanned. Welcome, Annette.
Thank you.
We're glad you were able to join us today. We know you're busy,
Always,
scanning a lot of patients.
always busy. It's my pleasure. Thank you so much.
So like I mentioned, you started your career back in 1982.
Yes.
What inspired you to start back then?
Well, actually, as a child, I was always artistically inclined. I was really good at drawing and painting, and I love colors. I knew all the names of all the crayons in the Crayola box. I knew all the names. So when it was time for me to choose a career, I did choose graphic design in college.
Oh, wow.
And my professor did offer for me to get a job doing fashion illustration at Women's Wear Daily magazine, which was very kind, but I figured that I would want to ideally work in a hospital because it's a steady income. And so I was able to join the X-ray tech program in-house at Huntington Hospital.
Oh, wow.
Dr. Robert Henderson was my first mentor who let me join that program in 1980, from 1980 to 1982. I figured that maybe I'll do that as a career and do graphic design freelance on the side, but it turns out that I love working with patients so much that I just stayed in that field.
It sounds like a lot of people start in the X-ray. You started X-ray first, huh?
I did stay at Huntington Hospital for 5 years doing general diagnostic X-ray with inpatients.
Yeah.
And then MRI came on board, and it was such an exciting modality. The images are so cool.
So you did MRI too?
Well, I was interested in doing MRI, and then there was an opportunity for me to do mobile MRI.
Oh, wow.
And that's the way that I learned. So I did that for a year, but unfortunately, it was a 12-hour day.
Oh, yeah.
And then driving home 35 to 65 miles.
Wow.
And one time, from Anaheim to Pasadena, I almost crashed into the center divider on the 5 freeway. So I said, that's it. So then I found another job at Glendale Memorial Hospital, where I was actually in the radiation therapy department, helping to map out the areas for treatment.
Oh, wow.
Doing plain film x-rays and fluoroscopy, measurements, and marking the skin, which is really fun. And I was doing mammography as backup for lunch coverage for the one technologist who was there on vacation coverage. So that's how I was hired, but then eventually they switched me to full-time as mammotech.
Yeah.
And actually, it was just one mammo room, but then Dr. John Ferrand, who's our radiologist with Hill Medical Corporation, he was working there with me, and he actually built the breast center, brought in all the modalities.
Wow.
So that's how I got started in mammography as a specialty. It wasn't planned. It was just like a calling for me.
Right, and you clearly love it.
And I love it.
Yeah.
I love it.
Yeah.
I'm helping patients. I love it. I feel like my life is fulfilling this way.
How has mammography changed from when you first started to now?
So in the beginning, we used Kodak film and film cassettes, and so we would take the pictures, and then we'd have to walk to the process, go in the dark room, walk, and run them through the processor. It was a long process, so the patients would wait 10 minutes. We had to make sure that we got good pictures.
Hmm.
But now everything's super fast. It's all digital, and it's such a luxury. Everything's digital, computer. We see things instantly, and it's much faster. And even back in the day, the machines were mechanical, so we'd have to compress them, take the picture, then run to the foot pedal
Mm-hmm.
and release it.
Oh my
But
gosh.
now no, we can it releases automatically.
Right.
From the,
Wow.
so it's I mean every second counts for the patient comfort. So
Yeah.
A lot of
everything's quicker now.
a lot of advancements that
Oh,
you
so
know
many advancements.
have made it easier for you and the patients, and the fact
Correct,
that it's a lot
correct.
quicker and everything probably gives the patients peace of mind more so
Yes.
than
Yes.
prior.
Before.
Yes. Now,
Yeah.
now I can do a mammogram in 4 minutes.
Oh, wow.
Yes.
4 minutes?
Correct.
But in the very, very beginning, when you were doing it in 1982, how long did it take?
Well, I would say up to 30 minutes.
That's a long
Right.
time.
Right. That's a long time.
Wow.
Yes.
I do want to ask you something
Yes.
about mammograms.
Yes.
So, a lot of women who have said mammograms are uncomfortable.
Yes.
How has modern technology changed that?
Okay,
For
so
them.
so back when I started,
Yeah.
as I said, it was film screen, it was mammography,
Mm-hmm.
and the detectors were not as sensitive as they are today.
Oh.
There were just a few photocells
Mm-hmm.
that would make the picture, but now the whole detector is more advanced and active. So back in those days, we had to compress as hard as possible. No exceptions. The radiologist
no.
would ask us to just press as hard as you can
Yeah.
with everybody
They must have been men.
to spread out
They don't.
to spread out the tissue
Oh.
evenly.
Mm-hmm.
I mean, they as much compression force as you could possibly use,
Which they
That was the
probably
standard
needed so they
that
could
they
see.
needed that because the technology was not as good.
So, I've heard it's based off of compressions are like how many pounds that you would
Yes.
do. So, compression compared to what is a typical compression of pounds are we compressing now versus
Well,
before?
Personally, I don't always look at the pounds of compression.
Yeah.
I will look at the skin to see how taut it is.
Uh-huh.
And it's important to look at the patient's face,
Mm-hmm.
even if they don't say that they're in discomfort
Yeah.
or pain. You can look at their face and look at their eyes, make sure that they're comfortable
Mm-hmm.
and they're not sweating, they're not ready to
Their hands
faint.
aren't in fists or yeah.
Yes, have
Oh.
them try to relax their shoulders
Yeah.
down. And so I don't always look at the pounds of compression. I
Mhm.
just look at this breast and make sure it's adequately compressed.
Mm-hmm.
I start out with a foot paddle till it touches the skin.
Mm-hmm.
Then I switch over to the hand knob and go very slow compression. I talk to the patient, say, "Are you okay? Can I go a little bit more, a little bit more?" And we work together, and they tell me when it's time to stop. So we can
Oh.
get the ideal amount of compression, but without hurting them.
So you're really listening to the
So-
patient.
oh,
You're
yes.
really paying
Yes.
attention while these women are coming in to do their mammograms.
Yes, and especially when it's a baseline exam, I do tell them, "I'm not gonna hurt you. You're just gonna feel some pressure for a few seconds. It's not supposed to hurt," because they've heard those stories about the old days
Yeah.
when we did indeed compress more than now.
Wow.
Mm.
So it did actually used to hurt. That was
It-
a
it
valid
used to hurt.
complaint.
It used to hurt. That is true.
Oh.
But now the companies tell us that we don't want the patients to have any pain.
Yeah.
So we don't use a maximum amount of compression, but we do get enough compression to get a good image.
But I think you have to be while you're doing the mammograms, you're the one that's positioning them. You're the one that has to make sure they're against the machine, making sure there's
correct, and-
compression. So you have to be skilled in that sense.
Correct. And that's another point is the most important thing is to get as much of the breast on the detector as possible. So we do have to tell them, I'm gonna pull your breast in close. I'm gonna start compression way back by your chest muscle because we need to see everything. Make sure there's no cancer hiding way back or underneath the breast. That's very
Yeah.
important.
Yeah, because that is possible.
Oh,
So,
that's possible.
yeah.
Yes.
You'd rather be a little uncomfortable for a couple minutes just to make sure
Oh,
that
just
everything's
seconds,
okay.
seconds.
Yeah,
Mhm.
just to make
So-
sure that everything's okay.
Right, because if we cannot see the cancer, then it cannot be treated.
Yeah.
If a patient's coming in for their first mammogram, their baseline mammogram, what would you want them to know?
Well, that's the first thing. Like I said, the first thing I tell them, don't worry, it's just going to be pressure for a few seconds.
Mm.
I'm not going to hurt you. I'll be talking to you the whole time, making
Mhm.
sure you're okay.
Oh, that's
Because
good because then you're kind of talking them through the
Right,
procedure
right.
and
Mhm.
distracting them a little bit.
Right. We
Yeah.
can distract them a little bit, and but
Yeah.
Do you ever find that patients come in and they don't want to talk to you? Do you ever have
sure,
difficult
sure, sure,
patients that
sure.
come
You have
in?
to you have to sense that. If they don't want to talk, you just don't talk to them.
Mm,
Whatever they're more comfortable with.
Yeah.
Yeah, just give them the position instructions, and that's it, and just don't talk.
Yeah.
We
Just
have to kind of feel that out. Yes.
read
Mhm.
their body language and
Correct.
yeah.
Yes. Sometimes they're anxious. They don't want to talk. They're just like, I'll get it over with. Okay,
Mhm.
fine.
Yeah. So over the years, how have conversations about breast health changed?
Okay, so nowadays we are informing the patients if they have dense breasts, and that is actually a law. That's California law. So if the patient has dense breasts and her physician doesn't tell her, then we're also responsible for telling her and letting her know that breast screening, whole breast ultrasound is also an option as a secondary screening to help to see through the very dense breast.
And what are dense breasts? What does that mean?
Well, dense breasts are the glandular tissues that produce milk, and it shows up as white on a mammogram versus a gray, which is a fatty tissue. So the
Mm.
dense tissue is hormonally active, and it's also more prone to develop breast cancer, and it's also harder for the mammogram to detect it because dense breast is white on the mammogram, and so is a cancer. So we're looking
Mm.
for white within white.
So I know for a 2D mammogram, it's just two photos, whatever comes up looking suspicious, it's just two colors, right?
Right.
So with 3D, is that better for
Oh,
patients with
3D is
dense
much
breasts?
better. The radiologists love 3D
Yeah.
because actually the computer is so advanced that it creates slices like a scan. So
Mm.
the radiologists can scroll in and out of that white breast tissue with their high resolution reading monitor and see slices like a scan.
Oh, wow.
3D is the third dimension, which is
Yeah.
depth, just like in math. So
Yeah.
it's called 3D because 3D is the third dimension, is creating the slices.
Do you feel that women who have dense breasts, if they start off doing a 3D,
Oh, absolutely, yes.
it's a lot better than doing a
Right,
2D at
right.
the time?
And to the patient, do they notice a difference between a 2D and a 3D
No,
mammogram?
well, they don't notice any difference. I will tell them, okay, the breath hold will be a little bit longer, just to warn them, and I'll give them more thorough breathing instructions. But other than that, they don't notice that the machine is actually turning and taking 15 angles, which allow the computer to create the slices.
Yeah. So
So
it's
they
like
don't notice.
it's the behind the
It's
scenes that's doing it. It does
right,
it's really
and
no
it's
difference.
the same amount of compression.
Oh,
Yes.
so why not do 3D then? Like,
Oh
is it
well,
recommended for everyone,
it's
you think?
recommended for everybody, but it's up to the physicians
Uh-huh.
to order it that way.
Oh.
We also give the patients option of upgrading when they come in, if
Oh.
their insurance will allow.
Oh.
And actually, all of our machines at where I work at the Cordova Huntington-Hill Imaging Center have been upgraded to 3D.
That's great. So
Yes, it's great.
Cordova has 3D, guys.
Yes, we have two machines, and they're both 3D.
Oh, that's awesome.
Yes.
And it helps like quickly do the exam. It's
It's
just a
very
little bit
quick.
of
We
hold time.
we get the patients in and out very quickly. We don't like for them to wait any longer than 5 minutes.
That's
And
great.
they usually get their results the same day,
That's
if not same
awesome.
day, then the next morning.
That's really awesome.
Yeah.
It is. It's awesome.
Again, gives them that peace of mind.
Right. Right.
Yeah, especially
Right.
yeah.
Because that's another part of anxiety is not just being compressed, but actually waiting for the results
Mhm.
and making sure that they don't have cancer.
Yeah. Even if it's a screening mammogram and you don't have any issues and
It's-
you're just going in to check the box of, okay, I'm doing my annual mammogram. I feel like the moment you walk away, you're like, wait a minute. What if?
Right. There's
Yeah.
still
There's a
anxiety
finding.
until you receive the results.
Yeah.
There's still anxiety, yes.
Yeah, I could totally see that. I feel like I would be a stress case even though I had no issues.
Well, Annette, you've cared for patients through the generations. What does it mean to you seeing a patient return year after year and trust you with their care?
Oh, it makes me feel so good. Like my job is rewarding because they
Mhm.
feel comfortable with me, and it's like seeing a friend, somebody that they won't be as stressed out because they know me and they know that I'm not hurting them.
Mhm.
So it makes me feel really good. I'm the same with my dental hygienist.
Yeah.
I feel comfortable, and she's my go-to person. It's just, it makes it less stressful.
Yeah, because the patient's in a vulnerable
It's
position.
very vulnerable part of the body.
Yeah.
Yes.
Yeah. But you have this very sweet demeanor.
They
Like
do
you
tell me
just
that,
walk
so-
in, you're like, oh, like you just feel like a warm hug even
Oh,
just
Yeah.
talking.
thank you.
Yeah.
Thank you.
Yeah.
Can you remember any times that you have a patient come in and just ask for you specifically?
Oh yes, that happens, and I'm perfectly fine with that. I'm happy for them to request me.
Yeah.
Yes, it happens a lot.
It's like seeing an old friend.
Sure,
Yeah.
sure.
Year
And they
after
trust
year.
you.
Yeah.
You they had a good experience
Correct.
with you years prior and they want to continue that good
Yes,
experience.
Mhm.
absolutely.
Is there a moment that stands out to you of like a really special moment with a patient?
Yes, well, there is, in my long career, I've more than a few times I've seen a patient who had a breast lump that they were aware of, but they didn't come in right away, and that breast cancer grew from the center of her breast all the way outside into her skin and caused ulceration, and
Oh
she was just they're too scared to come in. And
Yeah.
when I take care of these patients, I feel like I'm glad I was able to help them because I treat them with respect and dignity. I don't scold them or lecture them. I just do a
Mhm.
very gentle mammogram and then hand them off to the ultrasound technologist. And I don't make a big deal, and I don't say to my coworkers, "Oh, look at this, look at this." I treat them with dignity and respect, and I'm just glad that they did come in.
Yeah, when they did.
Right. But it happens. We
Yeah.
have actually last year there was one patient who was very good at coming in every year for an annual mammogram. And then we detected a very advanced cancer that had just grown in several months. She had no lump, no symptoms, but it was just a very aggressive cancer. So good thing that she came in for her annual mammogram. It was very well seen on the mammogram. Bright white calcifications and abnormal white tissue.
So the year prior, her mammogram was clear, and
Yes.
and then the next time
and
she came
that
in,
just really blew me away because we don't see that very often.
Yeah.
Most of the time, the cancer is slow growing throughout the years, but this one was
So aggressive.
so aggressive. It's just really reminded me, wow, this it's really true that annual mammograms save lives
Yeah.
every year,
every year.
not every other year, every
Correct,
year.
correct, every year.
Because if
every
she had
film.
followed the every other year
Right.
guidelines that
right,
some
it would've-
some people
yes,
recommend.
Yes. So
Yeah.
that was well that
Yeah.
was a case I really remember.
Yeah.
And it was just recent, just last year.
I think it's important as women too that we need to take care of ourselves. We need to prioritize ourselves and our health. And like you said, 5 minutes, you're in and out really quick.
Right.
Make the 5 minutes for
Just
yourself.
another thing to check off your
Yeah.
list. Okay, I'm
Yeah.
taking care of
Yeah.
myself.
It's
I
a lot
did it.
quicker
I got
than
it over with.
Yeah, it's a lot quicker than going and getting your nails done or going to the gym, and those are things that we do to make ourselves feel better
good.
and to treat ourselves.
Yeah.
This is another way to do that. So you can, it's and just once a year.
And from the minute they walk in the door, the receptionists are so kind and
Yeah.
helpful, and so it's a good. We do care about the patient experience overall.
Yeah. What do you think is the first thing the patient notices when they walk in through the doors?
Well, they notice that the facility is very clean. Yes, I think that's the first thing they notice.
So from your experience, how does the team at Huntington-Hill work together to make sure that the patient feels cared for?
So the whole team at Huntington-Hill, everybody, every job description, they're all kind people. They all care about the patients truly, and we all work together. We all have different jobs, which are all necessary for us to function as a team. So everybody works together, and everybody's very kind in order to take care of our patients. And when we're not rushed, we're not stressed out because we're not double booked, triple booked. So it is a calm atmosphere, friendly atmosphere.
Yeah, I've experienced that. Just walking through, being a fly on the wall.
If a patient is nervous or delaying their mammogram, what assurance would you want to share with them?
Well, I tell them that it's not going to be as bad as you may have been told by your friends, coworkers, or family members. I'm going to take good care of you. I'll be talking to you the whole way through. You're just going to feel pressure. I'm not going to hurt you. You're going to be fine. You're going to make it through fine.
Yeah.
Yes.
I had a screening mammogram, or actually mine was a diagnostic a few years ago, and it was my first one.
Oh.
It was so easy.
Good,
I
good.
think I said that on a podcast prior,
Oh.
but it was, yeah, I had all of these like,
Great.
what's it going to feel like? And it
Yeah.
was so simple.
I
Very
think
good.
it's because people tell you, other people who have
Right.
had mammograms, maybe they've had it years
Yes,
before,
like the
where
patient's mother.
yeah, like where the
Mhm.
technology wasn't there yet. So of course, yes, it hurt because
Right.
compression was needed.
Right.
However, nowadays, I volunteered for one of the
Yes,
I,
thank you
I
for
was
that.
a volunteer recently. I wanted to learn more about mammogram. And I remember you being the most gentle with
Oh, thank
me
you.
as I'm being a model over there for your CEUs. I remember being like, oh, Annette is so gentle.
Oh.
Like when I need to do this, I'm
Stacy.
definitely going to come to
Okay.
you.
Yeah.
Yeah, in a few years.
Yeah, in a couple of years.
And if you look at our reviews too, if you go to, all the Huntington-Hill
Mhm.
Breast and Imaging Center's reviews, if you read the patients that have had screening mammograms, 9 times out of 10, they're positive reviews.
Yes.
So if you are unsure, go look at the reviews and see what
Yes.
the patients are saying. Don't just take our word for it, but that's
Yeah.
what the patients are saying.
Correct.
Yeah.
That they had a good experience and that the tech was so kind and
Mhm.
gentle and it was fast.
Mm.
All of our mammal techs are very kind
Mhm.
and
Mhm.
caring and friendly. So we're lucky to have them.
Shout out to the
Mhm.
mammal tech.
Yeah.
Yeah.
You have to be a certain kind of person. You have to be very empathetic and
Yes.
make sure you're listening to the patients in
Mhm.
order to be in this kind of field.
And we care about their health. We do encourage them to come every year
Yeah.
for their screening.
Mhm. So after 40 years in mammography,
Yes.
Which is
what's-
crazy. Like when you think about it, that's crazy.
What message would you like to leave with patients about taking care of their breast health?
So don't be afraid to have your mammogram. We're going to take good care. We're not going to hurt you. It's a very important test to have to detect breast cancer early so that you will live. It's not a death sentence and you can get your treatment and everything will be fine in most cases.
Yeah. And just like mammography's come a long way, should you have a finding on your mammogram, not only is mammography technology advanced, the treatment after is very advanced.
Oh,
So
yes,
come
treat-
in soon and don't delay your mammogram.
Yeah,
Yeah.
treatment is always improving.
Yeah.
Yes.
There's a lot of money in treatments for breast cancer. For breast cancer awareness is such a big.
There's
Oh,
a reason that Breast Cancer Awareness Month is such a huge month.
Yes.
Like
Yes.
everyone, because I feel like everybody knows somebody
who's had breast cancer.
who has had some sort of scare or everybody knows somebody who knows somebody. And I think that alone should show you how important it is to come and get your screening mammogram.
Yes. I mean, cancer affects everybody for
Mhm.
sure.
Yeah. So, but it has been made so easy. Insurance covers it every year.
Yes.
Just
Just
Yes.
come in.
Come
It
in
takes
quickly.
Come on,
5
and we'll
minutes.
take care of you.
Mhm.
Yes, and you
Takes
can
5 minutes.
be reassured. You did something good for yourself. You check that off the list.
yeah, and if if your doctor will let you have a 3D mammogram, then
Yes, it's
push
ideal.
for that if you
Ideal.
can.
Advocate for yourself and
Yeah.
ask for a 3D mammogram.
Mhm.
It's the best technology.
yeah, especially with the dense breast, like you said.
Correct. But
Instead of the flat image, the
Right.
doctors can look
it's
through.
also good for fatty breasts, but especially for the dense breast.
Yeah.
Yes.
And you know what, Lynn? I can speak for myself. Like in the Asian community, there are a lot of women who naturally have dense
That is
breasts.
correct.
Yeah.
Yes.
So therefore, I feel like to know this information, you should always advocate for
And
yourself.
some people stay dense their whole life. It
Yeah.
doesn't revert
Yeah.
back to fatty. So
I learned on my mammogram that I too have dense breasts.
yes, it's very common. It's very common. It's
Yeah.
normal.
Yeah.
Mhm.
Yes.
And I was like, I actually know what that means. Yeah, I was like,
Well, Annette,
Yes.
if you've been doing this for 40 years, if you did also talk about you were going to be a graphic designer. If you weren't going to choose those career choices, what would you have done with your life?
Well, I love animals, so I also wanted to be.
of course you do. You are somebody who would love animals.
And they love me too. So.
Of course,
So,
yep.
so I actually wanted to work with dolphins, be a marine biologist, but the way my brain works, I'm very visually oriented. I'm not good at math. I couldn't make it through the math part to get in finish the chemistry courses and so that's something I was interested.
You
But
just want to swim with them. Yeah.
So like I said, it was a calling. It was just something that was meant for my life.
Yeah.
Yeah.
You strike me as somebody who would love dolphins. Like everything you're saying, I'm like, oh, of course.
Dolphins.
Well, Well, thank you, Annette.
Oh, thank you.
And thank you for tuning into the Healthy Image podcast. We hope today's conversation helped ease concerns, provided reassurance, and encouraged you to prioritize your breast health. If you found this episode helpful, please share it with a friend and subscribe for more educational, patient centered conversations. And as always, stay engaged, stay curious, and stay healthy. Bye.
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 Bye.